All right, thank you for having me talk to you all today. So I'm going to talk to you today about Brain Tumours Online, which is an evidence-based online resource for those affected by brain cancer to provide high-quality educational resources, peer support, and guide for symptom management and self-care that's taken 10 years of work behind the scenes and which will go live in about a month. So in this quick overview of Brain Tumours Online, I'll cover what is the resource and how it came to be. I'll focus on how we've built the prototype and our imminent plans for it to be used and evaluated. So 10 years ago, I was a medical student and Professor Kate Drummond had no professor in front of her name. As many of you here will attest, Kate Drummond is a caring surgeon and a strong patient advocate. She saw her patients and their carers grapple with a brain tumour diagnosis. And although they were desperate for information and peer support, in-person support groups were challenging. And the reason behind this are manifold, including having symptoms which impact your ability to get to in-person support groups. For example, driving restrictions if you've just had surgery or if you've had a seizure. Also, Australia's big and brain tumours are relatively rare. So we know patients who live in rural areas may have to travel 2-3 hours to get to an in-person support group. So Kate had an idea to overcome these barriers, make an online resource for brain cancer patients. This would get around the geographical or social isolation issues and allow patients to connect and support each other securely. And if it was curated properly by specialists in brain tumour care, could also deliver high-quality educational resources. Now, back in 2013, there was already a plethora of online interventions for cancer patients in general, targeting breast cancer and other more common cancers. So the plan was simple. Work out what evidence-based online supports existed for other cancer patients, then using a validated framework, curate one specifically for brain cancer patients. And that's where I came in. That's where I came in. I can't scroll down, but that's okay. So I did a systemic literature review looking at brain cancer, at cancer interventions for cancer in general, online interventions for cancer in general, rather than specifically for brain cancer, because we were hoping to leverage what the evidence base already was and make something specifically for brain cancer patients. So my literature review showed that, sorry, there's a few little buggy things on this slide, apologies. My literature review showed that despite the huge number of online interventions available for cancer patients, most had not been rigorously evaluated. In fact, out of the many hundreds of online interventions available for brain cancer patients, only 14 had been properly evaluated. Even more concerningly, those that had been rigorously evaluated demonstrated mixed efficacy. So while some conferred a benefit for patients, some were neutral, and worryingly, some even caused harm. So in scrutinising this, it appeared most interventions were made based on what doctors or researchers thought would be a good idea rather than assessing patient needs. So we introduced another very important step in our plan to create Brain Tumours Online, and that was a needs analysis for the brain tumour community. The needs analysis involved surveying 200 patients in the waiting room of the brain tumour clinic at the Royal Melbourne. And we found that, as expected, our patients came from far and wide, with a third living 50 kilometres or more away from the hospital. Also, many were unable to drive, emphasising the need for an alternate in-person support groups and events. In understanding what people wanted from an online platform, we inquired if patients currently turn to social media and online interventions specifically for problems related to their brain tumour. Interestingly, we found that patients were using unregulated platforms and sites for support. And importantly, many found this support led to an improvement in their social functioning. For example, patients who use social networking sites specifically for problems related to their brain tumour, 90% felt this led to some improvement in their ability to take in new information. So for us, this was quite unexpected, but it did emphasise the need to build a high-quality, secure online resource that would bring our patients together for support. The most important thing we took away from that needs analysis was understanding what patients valued in an online platform that they engage in, specifically for problems related to their brain tumour. So this included control, of access to their personal information, flexibility of time and location of use, ability to filter information and advice, health professional contribution. They valued hearing about the experiences of others as well as sharing their own experiences. Wow, there is a slide missing. That is okay. So in 2020, Professor Drummond now had a professor in front of her name, and she was running the Department of Neurosurgery at the Royal Melbourne Hospital. I was in my second year of training at the Royal Melbourne Hospital as a neurosurgery trainee. We had not let the fact that we had been knocked back multiple times to get grant funding to make this a reality dampen our spirits, and we partnered up with some amazing colleagues at Peter Mac and the University of Melbourne and other partner sites and applied for a big MRFF grant. And we were fortunate to secure $2.6 million in funding to make this a reality, and so our team exploded. So just from 2 people to lots and lots and lots of people. So we had a lot of time to think about this project and understand the team we needed to make a useful resource for patients. We knew we needed this range of experts. So you can see clinicians, digital innovation boffins from the University of Melbourne, website designers, and most importantly, community advocates. Now, these are people living with brain cancer or caring for loved ones with brain cancer, and their input into the building of this resource has been invaluable. The MRFF grant has funded this part of the project. So proudly, we are currently finishing the co-production phase and we'll be entering the implementation and evaluation phase in late June. So what does the platform look like and how can it be used? It has a website that is accessible via phone and via computer. Based on our foundation work and reinforced by the findings from the phase 1 co-design work, Brain Tumours Online has been built with 3 pillars to address the unmet needs of people affected by brain cancer: Learn, Connect, and Toolbox. The Learn pillar contains high-quality educational resources curated by brain cancer specialists to allow users to be confident in what they read. There's a mixture of links out to trusted sites and content generated by our own team. For example, a video describing the typical experience of chemotherapy for brain cancer. So the Learn pillar can be used in a number of ways, but essentially forms a repository of vetted research and information to support patients, carers, and healthcare professionals that are looking after people with brain cancer. Our Connect pillar is the one closest to my heart. And, you know, that's really the reason I got involved a decade ago and have followed this through to implementation. Connect is where patients and carers can connect with others going through similar experiences. The community forms a type of social media where people may choose to join small group chats that are relevant to their situation. For an example, a group that's only open to carers, or a subgroup created by patients for those who have a brain tumour and have children. These groups will be moderated for safety and to encourage engagement. The Connect pillar also has online events that include webinars, live Q&A sessions with experts. These are of course recorded so people may attend and interact, but also have the option to look back on past events of interest. The stories section of the Connect pillar is where people can read or see videos about the stories of other carers and patients, and also where patients will have the option to share their own story. Finally, the Toolbox section fosters quality of life support through use of validated self-guided web-based tools. These include support for patients around monitoring and managing symptoms. For example, access to the Shut-Eye program, which is an evidence-based intervention for insomnia. There are also support resources for carers, e.g. Carerwell, which provides self-guided psychosocial and general wellbeing support for personal and caregiving needs. Now, what our literature review told us about online interventions for cancer patients is that evaluation is key. We must understand if Brain Tumours Online is conferring a benefit for users and, importantly, not doing harm. So the things we aim to establish about the Brain Tumours Online platform in order to understand its usefulness include usability, efficacy, effectiveness, feasibility, economic value. This is, of course, it's a free resource. Economic value involves assessing if it can be useful from health economics perspective. And this is the type of information that we'll be collecting from the website during the evaluation phase. Web analytics, patient-reported outcome measures, baseline and exit surveys, qualitative interviews, and additional data depending on a user's engagement with the platform. Optional collection of Medicare data for health economic analysis will also be taken. As I mentioned, the next phase of this study, the implementation and evaluation, is planned to start at the end of June. This will involve appropriate people, so adult patients with brain tumours, their carers or healthcare professionals looking after people with brain tumours, signing up to the website and agreeing to be part of the study. As this is the evaluation phase for the website, participants will give consent as they sign up, agreeing to use the site as well as to participate in surveys and give feedback from time to time, as just discussed. There will be iterative improvements in the content as the platform matures and users give us feedback. Importantly, we'll also be looking to use our feedback to make this a standard of care, funded and accessible to brain tumour patients, carers and healthcare professionals Australia-wide looking to the future. So thanks to all these smart people who work extremely hard on this project. Particular mention to Kate Drummond, who's coordinating the development of this platform and wrangling everybody here on the screen, and Sarah Bray, who is our project manager, who is absolutely brilliant. She is dedicated and just always goes the extra mile. And of course, all the patients and carers that have supported this project. Thanks.